In this morning's Women's Doctor, premature menopause can be a predictor of heart disease. Women who reach menopause before they're 40 years old have as much as a 40% increased risk of developing coronary heart disease. That's compared with women who don't go through that transition early. Mercy Medical Center Dr. Terry Hoffman says it's important for women to be screened and managed appropriately. And Dr. Hoffman is joining us now with some more information. Good morning. Thanks for joining us.
Sure, glad to be here.
First of all, what are some of the reasons that women go through such early menopause?
Well, we don't really know, but it may be kind of an autoimmune type of thing where their body is attacking their ovaries, prematurely. We haven't figured out all the nuances of it, but we know that it's something that's concerning. We know that women have less risk of heart disease because of not going into menopause till 50. Up to that age, they are generally healthier cardiac-wise than men. So then when you kind of subtract 10 years or more off of that number, average age of 50 or 51, then you run into problems.
And so what is it about that process that causes a potential problem with the heart?
Well, we think that the estrogen is actually protective against myocardial infarctions, coronary artery disease. So if that estrogen, those levels go away prematurely, then your heart ages older. In other words, I just saw a lady in the office who went through premature menopause at 21. She is 36. She does not have the heart of a 36-year-old. She has the heart of a 66-year-old. When you think about that, her average age should have been 51 and now it's 21. So her heart is aging more rapidly than her body age. So one of the things we talked in the office was that she really needed to talk to her primary care doctor and remind him, hey, I haven't had my period since I was 21. I'm really kind of cardiac-wise much older, so if it's appropriate to do a stress test or if it's appropriate to do an echocardiogram or to manage things more appropriate to her heart age, not her chronological age.
And so what are you recommending women do? We talked about early screening. What is the screening test for this?
Well, it's really about talking to your primary care doctor. I'm a gynecologist and I do pap smears and I can do blood pressure and I can talk to you about risk factors associated with, different things. But when it comes to the actual screening mechanisms, you need to have a conversation with your primary care. I am sure that most primary cares looking at a 36-year-old woman across from them don't think of the fact of whether she's in menopause or not. So I think this article kind of brings to light, one, how important it is, and the fact is that African-American women are more likely to go into premature menopause. So it needs to kind of be added to one of our screening tests. Not only do you have a family of heart disease, but have you gone into menopause and what age were you?
Okay, and so really important is I want to ask you this before we go, and I have to be fast here, but an IUD can stave off menopause for women. So does that play any sort of role in women in terms of like wondering if they're at a risk factor for this?
Well, and what an IUD does is it prevents you from having periods, but it doesn't necessarily affect ovarian function. And what premature menopause is what your ovaries are doing. In a woman that's had a hysterectomy and she's had her uterus removed, she doesn't have periods, it doesn't mean she's in menopause as long as her ovaries still function. So an IUD doesn't, we don't put in IUDs to prevent premature ovarian failure. Since we don't really know why it happens, it's really hard to come up with a way to prevent it. It's more about being aware of the fact and taking appropriate steps to prevent the development of heart disease in the setting of premature ovarian failure.
All right, comprehensive answer. Thank you so much for that, Dr. Hoffman. Really appreciate it. And thanks again for joining us.
Okay, thanks. Have a good day.
You too. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.